Hello, my name is Dr. Sadia Gilani, and I'm a psychiatrist that practices in Hamilton, Ontario. And I'm also the founder of the Lighthouse Foundation, an organization that helps blind children with education in Pakistan. Today, I was particularly interested in talking about dementia and depression, especially related to the elderly population. So we'll start, and I want to thank you to Muslim Women of Bonn for inviting me to do this talk. So what is dementia? Dementia is a group of cognitive disorders that can affect a person's memory, language, problem-solving skills, and changes in personality. And it can really affect the person's ability to function in day-to-day living. And we call these cognitive disorders. These are a group of disorders, and there are numerous types of these forms of dementia. A lot of people often think it's only Alzheimer's, but it's not. Alzheimer's is one of the most common ones, but we also have other ones such as vascular disease, or in other words, what we call strokes. They also lead to dementia. Brain injury, Parkinson's disease, and medical conditions such as some infections can also lead to dementia, as well as a lot of people may not know, but substance abuse and alcoholism can also lead to dementia. So this is some of the reasons why dementia exists. So why is dementia important to diagnose early? One of the reasons it's very important to diagnose dementia early is because if it's diagnosed early and treated, its effects can be slowed down, and the quality of life of a person can continue on for a much longer period of time. And in some cases, it can also be treated. So that's one of the very important reasons that we need to diagnose this early. Okay. So now we're going to go on to what is depression. So depression is a mental disorder that affects people from all ages, all walks of life. It doesn't not pick and choose who gets depression, and it's often a neurochemical imbalance. The prevalence of depression in any given community is about 5.4% of the general population. So what does that mean? That means that the percentage of the population at any given time that many people are suffering with depression. So it's important to recognize that this is a very common illness. So what happens with depression? What are the factors that can increase depression? So the depression risk increases with age and other conditions. So when we talk about age, as obviously when we get into the geriatric population, the risk of depression increases. And also when we talk about medical illnesses, so people with underlying medical illnesses, the risk of depression can also increase. Family history is another reason. So if there is a family history of people in your family, your mother, father, like direct relatives, siblings, brothers or sisters that have it, the risk also increases. And depression can range from a very mild to a very severe case. So in severe cases, what happens is the person can no longer function. They often need to be hospitalized. And often suicidal thoughts and attempts are also much higher risk. So people with severe depression have a very high risk of suicide as well. And we need to keep that in mind. And one of the things that I want to talk about is the suicide rates are actually much higher in the elderly population. Elderly population over 85 have the highest rate of suicide, in fact, 7 times higher than the general population. So what are the signs of depression? So one of the hallmark signs of depression is the loss of interest or pleasure in daily life. Things that used to make you feel good or you enjoyed, you no longer enjoy them. And a decrease in energy, or could be mild to severe fatigue, isolation, withdrawal from family and friends. And there also can be sadness. However, this isn't always the case. sadness, increase or decrease in appetite, and feelings of worthlessness or hopelessness. These are often signs of depression. A change in your sleep pattern can also be a sign of depression. So sometimes people are sleeping too much, sometimes they can't sleep at all. So the other thing is that inability to function. So this is a very important factor. So when depression increases, the ability to function decreases. So ability to function in your daily life, even do your house chores, go to work, and at some point, if depression gets to significant, a person may have suicidal thoughts as well, and in fact, sometimes actually attempt suicide. So we have to keep this in mind when we're looking at depression. So how do we treat depression? The good news is depression is treatable. Your doctor is the first person that you should talk to, and they can order some, tests to make sure that you're not having any other cause of depression. So sometimes having a thyroid problem, like having a low thyroid or other hormonal imbalances, sometimes alcoholism, substance abuse can also look like depression, but we make sure that we clarify that before we label it as just clinical depression. So it's important to have those things ruled out. And then your doctor would often ask you some of these questions or give you a paper test to see if you are in fact depressed. What do we do after that? So how can we help treat depression? So your family doctor is the first source that you should go to. Just like with any other illness, you need to go to your family doctor. So they may either treat you themselves if they have knowledge of that, or they may send you to a specialist like myself, a psychiatrist, who can help treat with depression. And what do we do for treatment of depression? Depending on the severity of depression, it's important to know sometimes patients are treated within the clinic. Other times they have to be hospitalized. Again, it depends on the severity of the depression. So we often use medications like antidepressants, mood stabilizers. Sometimes even in severe cases, we have to use antipsychotic medications. So therapy, which is talk therapy, can be very helpful in depression as well. And there's a whole variety of therapies that are available to treat depression. In the more severe cases or cases that are not resolving, the treatment with electroconvulsive therapy, it's used in the hospital. So patients can also have ECT, as it's called, and it's very, very effective and in severe cases. And the last, if the patient is very sick, unable to function, suicidal, or very psychotic, then what happens is they're hospitalized and in specialized units of psychiatry where they're treated under the care of psychiatrists. And sometimes, they're there for a while until they can be discharged. So these are some of the ways that we treat depression. So one of the things that I wanted to talk about is cultural issues, especially in the South Asian population. Often we don't see too many people in our clinics or in the hospitals, and it's not because they don't suffer from depression or suffer from any other mental illness. It's because there is a lot of stigma in our communities. So many people and their families feel very embarrassed to, have this diagnosis of dementia or depression, and they're very reluctant to go forward. So sometimes they will just ignore it, and unfortunately, the person suffers a great deal. Other times, they may, seek out alternative treatments, which are sometimes not very effective, and they really need to be treated properly with the help of a specialist. So this is one of the areas that we need to really change because there's so much suffering happening And we have the availability. We're in a country that has resources available to us that we can access, but we're not accessing those resources. So the second cultural issue that I often see is language barrier. So people are often afraid to talk to a specialist or a doctor because if they don't speak the language, they feel that the doctor won't understand their problem. They will not really be able to diagnose them. So this is something that I must say that regardless of what language the doctor speaks, the disease or the mental disease, we understand that. We can understand that through the help of a translator if patients bring in, and we can, help a patient whether they speak in English or not. So, and in the community, there are doctors that speak Urdu or Arabic or Punjabi. This shouldn't be a reason for somebody not to seek help. Okay. So the other thing I wanted to point out pertaining to the elderly population, our elders often have been very active in their life when they were younger. They have raised us as children. They have been participants in their communities. Unfortunately, when they come to Canada, they become very isolated. Or when they enter the community here, they don't get involved in community activities like they would have where they lived before. So what that does is it causes an isolation for them, and unfortunately, it really can affect a person's mental health. So I often encourage patients to become involved in activities that are meant for, maybe there are lots of activities that are available for seniors, volunteering, learning a new hobby or a skill, and becoming more active. So the more active you are in your community, the healthier you'll be, the more fulfilling you feel, that you feel a sense of self-worth, which is really important for our elders to feel that sense of self-worth. And unfortunately, they are often sidelined because we don't get them involved in those things. So that's another message that I really want to hone in on. Concluding remarks. So I hope, the topics that I'm talking about can be talked about, for a long period of time in great detail, but I just wanted to kind of touch base on some of these things. One of the things that I wanted to mention is that often depression can look like dementia. So sometimes a person will actually be suffering from depression when it's in fact looking like dementia. So sometimes they're misdiagnosed as dementia. They're started on dementia medications. They're not getting better. They need to be clearly diagnosed. And often we find that some patients, when we treat it as a depression, they actually get better and get back to feeling normal again. So this is kind of an overlapping thing that we have to often be careful about, is not misdiagnosing depression as dementia. So just want to put that out there. So if your loved one, like if your parents or someone is having issues with memory or like shutting down, slowing down, not involved, and you think, oh, I think they have dementia, they really should be looked at for depression first. So that's one of the things that I want to point out. What are the resources in Ontario? So first of all, your family doctor is, your central resource, because they're the ones that can initially look at you and say, is this something that I can treat, or is this something maybe I need to send my patient to a specialist? And what kind of specialists are involved in the care of the elderly when it comes to depression or dementia? Geriatricians. So geriatricians are specialists that only deal with the elderly population. Whether it's a medical illness or a psychiatric illness, they specialize in this. So your family doctor may refer you to a geriatrician. The second is a neurologist. So if if the doctor diagnoses that, you know, this is looks like a dementia, or it looks like multiple strokes, it looks like Parkinson's, I'm not sure what, I need to send you to a specialist for treatment, they'll often send you to a neurologist. So a neurologist who specializes in that area. And thirdly, psychiatrists like myself, we get patients that have a history of, it can be, you know, any kind of mental illness. It could be depression, anxiety, bipolar disorders, schizophrenia, a multiple rate anxiety disorder. So those are the kinds of mental health disorders that we diagnose and treat. Psychiatrists, I have to say, don't often, because of the shortage of psychiatrists in Ontario, we don't provide often therapy, what is called talk therapy. So we often link up with either psychologists or mental health supports to provide that therapy for you. I've listed a few resources in case, you know, anyone is looking for help. So Canadian Mental Health Associations and CAMH is one of the ones that I really wanted to point out is the Crisis Services Canada. It's a suicide prevention hotline. The other senior safety hotline. So I've put the numbers out there. And of course, 911 is always, if it's a severe emergency, if it's a life-threatening, or if, you know, someone is suicidal, to call 911 first, okay? So I want to conclude this by asking everyone to have, you know, be more compassionate with your elders in looking at dementia and depression and seeing the possible signs and symptoms and asking them questions, including them in your day-to-day life, and getting them out there in the community and getting them involved. And if they need to see a doctor, please have them see a doctor. All right, thank you very much. I want to thank Muslim Women of Vaughan for inviting me to do this talk.
Thank you so much, Dr. Sadia.
Thank you.